I'll start off by explaining what it looks like for families who have an individual with fetal alcohol spectrum disorder in their families, and what it looks like for us getting healthcare. So because there is a causal factor to FASD, there's a lot more stigma to it than a lot of other diagnoses. And it's unfortunate because of the how we have pictured FASD or FAS historically. I'm not driving. My husband's driving. I'm being very safe. So because of we have pictured it as being a disability that happens from an alcoholic, right? Like we picture like it just takes so much alcohol to cause this damage, which is such a it's a barrier to proper healthcare in and of itself, because women are under the impression that's true. Oh, this glass of wine is healthy. Interestingly, that study was the glass of wine was healthy for mom, not baby. So that's not accurate science. But that's the kind of stuff that will get in the way of somebody when they're going to talk to their doctor. So the first thing the doctor says is, well, like, are you an alcoholic? If you're not an alcoholic, you don't have to worry about this. So if a woman comes at her OB appointment and she's like, I didn't know I was pregnant for a while and I was drinking, doctors are usually very dismissive of the patient because honestly, I think some of it may be because for years they have been saying that alcohol is okay. And so like they're sticking on that path now. We can't divert. So there's that, like before pregnancy, and then after pregnancy, if you're talking about it, whether it's an adoptive parent or a biological parent, either way, doctors are usually like, no, it's not that. They're just boys. It's ADHD. They'll all grow it. All of these things that kind of don't let us address the core concern. And so that our kids aren't getting they aren't getting the interventions earlier. The goal is by age 6, but that, I rarely hear of that happening. So all of the stigma is what's getting in the way. Like, it's not like the interventions exist. There are possibilities here, but because when we go to our medical providers, we're not being heard. And because so many symptoms, when not treated, look like mental health conditions. And so then you're looking at like a superficial behavior versus the underlying cause.
It's a lot. It's a lot. And I think you bring up this really great point of just like, doctors kind of like, pushing you off of like, oh, it's probably something else. And like, sometimes it's often easier to like address these superficial issues because there's like a quick fix for it, or like, oh, they'll grow out of it. And I was kind of doing a little bit of reading on FASD, and I feel like the name kind of gives it this idea that it goes away once you move into adulthood, and it doesn't. It's just more that like you learn how to manage it, and since you're managing it in whatever way works best for you, people kind of forget that condition is still here. So it's interesting. It's a lot altogether. And then like this double layer of like you have this kid, but then you also have this parent that feels pretty bad for whatever reason about maybe not detecting it or misinterpreting it, or just a condition altogether. So it's a lot.
Yeah, I think that I have a lot of empathy for the position that biological parents are put in because of society's misunderstanding of the science, right? It's not that the science says that they're out, it's like everybody's misunderstanding. And so they get kind of pigeonholed into this idea of this is who you are. And that's absolutely not the case. I have many friends who have biological kids, and very often they, were told that they couldn't get pregnant. They didn't know that they were pregnant until later. Like it's not like they're like, oh, this is going to be so fun, I'm going to drink while I'm pregnant. So it just looks a little bit different. So yeah, we do have a relevant question though. They asked, how did you get into FASD? So you want to tell us a little bit about your background?
Yeah, definitely. So I just graduated from Emory School of Public Health back in May with my MPH in focusing in behavioral science and health education. Hi. This is my first Instagram Live, so this is fun.
Oh, very exciting.
So while in grad school, I worked at a graduate assistant in the Emory Brain Health Center, and specifically in their child psych department. And so within their child psych department, they have this clinic that's focused on maternal substance abuse and child development. And kind of from there, I got to work with a lot of the, the big wigs that work in FASD. And I kind of just sat in on a lot of clinical, case studies, or just learning a little bit more about it. And I just really kind of created this niche for learning about prenatal exposures. And I think it's a very interesting topic, partially because it has this duality of affecting kids and parents in different ways, and how you're able to implement treatment for both of those groups. I just find Really interesting. So I hope that answers your question. Oh, uh-oh. I was trying to tilt my phone up so it stays, but yeah.
Yeah, no, that is a good answer, and it made me think too about when you were talking about people imagine that this goes away in adulthood. We talk so often about kids, and a lot of time our focus is kids because we're parents, or because there can be like sometimes easier interventions when a kid is young. But realistically, these kids, whether there's interventions or not, they grow up. And they grow up and they are members of society, and they participate. And we of course hear a lot of horror stories about like kind of worst case scenarios, but there are a lot of individuals that are not diagnosed, that are not identified at all, that are doing amazing things, and many that are identified that are doing amazing things. But for those who have a harder time operating in society, there is a lot of them in homelessness and incarceration and all of those kinds of things that are going to give you even more barriers to healthcare, because it looks like a willful choice, right? So me walking into the doctor's office, maybe dressed like this, maybe a little fancier. Doctors listen to me, right? They assume that I know what I'm talking about, that I have the best interest of my child at heart. Like, it's just not a battle for me to get healthcare. Can you describe to us what other people may experience as a barrier to getting healthcare?
Yes, definitely. I think equitable access is kind of like what you're hitting on here, as like, you know, we all experience these barriers, partially just about the way we come into a physician's office. And a big part of that is our health insurance. Like, you know, it's kind of tricky. We're in this situation, specifically with COVID, where your health insurance is so linked to your employment. And let's say you're in this phase where, you know, you get laid off, or you're, you know, terminated from your job for whatever reason, COVID related, or just in life in general. One, that kind of puts you in a sticky situation, because if you need care, you're less likely to actually get care, because, you know, thinking about the costs associated with it, but also just thinking about, you know, walking into a doctor's office and having the ability to advocate for yourself can look a certain type of way, especially like, you know, if you're not dressed in, you know, the nicest thing, or if you don't have the vocabulary to describe what you're going through or what your child is going through, because it's easy to kind of misconstrue of, oh, you know, he's just had a really hyperactivity lately. You know, the first thing they may be thinking is ADHD and maybe not FASD. So kind of, you know, just having the language that doctors are able to communicate back and forth with you in, having health insurance that gets you into these specialized doctors that can give you a little bit more care in what you need. And that kind of gets me into like the gatekeeper conversation of like, you know, oh, it's okay, you're good.
No, well, our pastor walked up and wanted to just roll down the window. No, you can't. We're in a quiet room right now.
The car is a new quiet room. It makes sense. The car is a new office. I love it.
Well, okay, when you become a parent, you'll know that it's like a lot of a quiet room. Okay, so yes, I like what you say, and I had not thought that much about the vocabulary piece either. So, because obviously as an expert in FASD, I have the vocabulary, right? So I walk in and I say certain things that better express what I had not really thought about how important that is, because I have parents that come to me and they describe stuff. I'm like, yeah, but that's a superficial like symptom. We need to dig deeper. And when you dig deeper and explain that to a doctor, you're more likely to get help. So that's very interesting.
Definitely.
I like that.
Have like certain buzzwords that you can kind of use to pull on, and like, you know, the buzzwords that doctors are looking for to notify, like, you know, that they can differentiate a problem from another one. Health literacy is like another big issue that we have in this country, that we don't really know how to talk about how we're feeling. Mental health related, but also like physically, of like, where is the pain? What kind of pain is it? Like, what are the behavioral trends that you're seeing? How are you able to communicate it? And it just takes time. And, you know, like, you have a special interest in this, so of course you have more resources on it. And, you know, as we continue to educate people, it's kind of like, it takes a minute to pick up the language to be able to, you know, adequately explain it. But that's also, I feel like there's a burden on healthcare providers too, because they have to be able, you know, I want them to be able to kind of pick somebody or ask them more questions that may give them more answers, instead of just quickly being like, you know, you didn't say that, you know, they were having these facial dysmorphins that, you know, may lead to us thinking it might be FASD versus something else. But
there's definitely a gap in knowledge from physicians, because they will, I mean, we've heard so many things from clients, but it's stuff like, oh, well, you really have to be an alcoholic, and that kind of dismissive stuff. Or One doctor told one of my friends that her son could not possibly have it because he's happy. So
that's, kids should be happy. Like,
yes, that's
kids
the
should
goal,
be smiling. Dude. Yeah. Wow.
He said he's never seen a kid with an FASD that was happy. And so these are the kinds of, like, we need to break down the barrier, the stigma, the old science, because there are studies done 20 years ago that are just irrelevant now. And in 2013, we expanded the definition to include kids that didn't have facial features and the growth deficits. And so that changes the game substantially as well. So yes, so we walk in, we don't have, maybe we are concerned about going at all because of the health insurance aspect, which means that these health concerns are going to be dealt with in other aspects of society, right? We're going to have social worker involvement. We're going to have something going on at the school, something like that, that's going to be like handling what is at the core a health concern. And then if we do get to go, then maybe we don't have the vocabulary to explain what we need to, because it's so nuanced. It's not any vocabulary that normal. You would run into in any other part of your life. Yeah.
Very different, but it's interesting that you say that, because I was like doing a little mini research before I got on here, and there was like this figure, and it says FASD is a global health issue, it's a disabilities rights issue, it's a women's health issue, it's a food security issue. It's just like all of these things bundled up, and like it's kind of like you pull back a layer and you see there are 10 more below it, so you got to pull back those layers. So it's kind of like getting into that rabbit hole and down it to kind of get to that nuance level. But you know, one thing I like to do, and I'm glad that they extended that definition to just pull away from just the facial features, because it gives you something broader to look at, and something that, you know, you don't have to check these 8 different boxes to say that you have some type of FASD condition. You're able to say, well, maybe we're overlapping in something between here and something between there. And I think that, you know, makes parents feel better, because it's not like they're sitting here staring at their kid all day trying to figure out what's going on. Right. Yeah, but it's also like, you know, you kind of have this common ground of like, okay, so these are the issues that we're seeing, and these are the issues that I think we really need the most help in, and maybe we can focus here, and from starting here, we can kind of pull back more layers to get back to that, you know, wherever it's starting from. So, yeah.
Yeah, I think Canada's doing a better job at assessing kids, because they're working from the 10 brain domains, which is kind of like, if you've seen the like autism circle of symptoms, and it's like, you know, they color code it depending on how challenging that symptom is for you. Yeah. And that's kind of, I think, the direction that we're moving towards, is that we're going to start like picking out the brain domains that we're struggling with, versus assuming something that's like super superficial, like facial features or something like that. So yes, I agree with that. And then all of this on top of, in America, you know, having the challenges that we have as far as having racism in our public health system, having sexism in our public health system. Women are not heard as much. And so then if you're a Black woman going into saying that your kid is having behavior issues, like, it's discipline them better.
Yeah, and then we've got this, like, these 2 historical issues of, like, one, if there's this idea that Black people don't feel pain in the same way, or are lying about their symptoms, which you know is super duper wrong. Like, your skin color does not depict how your metric for pain at all. And then we have this other idea of, you know, the way that you discipline your children is wrong. So maybe you're doing too much of it, and they're acting out for this reason versus that reason. And then you kind of get to this idea of your parenting tactics are wrong, but like, you know how to parent your child, they're yours, you know. So it's a very paralleling situation, and I find it can be very frustrating, especially when it's something that you just don't know about, you know. How frustrating it be, to sit in a room and you're like, I'm coming here for help, and yet, you know, the things that you see visibly about me are easily just like, you know, nicking me down on what it could be. And I like that you said earlier, you know, talking about some biological parents or moms who just didn't know they were pregnant. And, you know, that's so common, especially, you know, just in today's society, or, you know, we can't even go to the doctor all the time because it's just not safe at the moment to think about, you know, just not knowing and being able to admit that, and sitting in a doctor's office and just you know, seeing the difference in facial expressions and how they're treating you when you're able to, you know, come to this point. So it's I can only imagine, you know, I don't have children yet, one day soon, day down the line, but you know, if these are things
don't
I
rush.
think about.
Wait till the pandemic's over, okay?
You know, at least that. But these are things I think about, because I do want to go into becoming a healthcare provider, about like, you know, what can I take from one side of being a patient to being a provider, and what can a provider take from being a provider into being a patient? Because, you know, it's kind of cool to be able to sit in both of those chairs, but like, what am I not seeing with one perspective versus another? So, and then adding in, you know, the social factors related to that as well. So.
Yeah, we talk a lot as parents in the community that we're hoping that doctors start like getting the more updated information, because right now when we're going to really the only people that are getting diagnosed, and not only, that's a strong, the vast majority of people getting diagnosed know what they're going in for. They're asking for it and they beg for it and they don't always get it. We want people who don't know what this is to get diagnosed. Those families who are struggling and are like, I am at a loss for what is going on. And we can identify this. It changes the empathy from a parent's perspective when you understand what this is. And we aren't giving parents that opportunity because we're so scared that it might hurt someone's feelings, or we haven't read science in the last few years. So so these are the kinds of things that we as parents are and advocates, I guess more specifically, are hoping for the future of FASD and how it can morph into something that is actually served in the healthcare system consistently. Not in like little packets.
Not in little packets, but like, I think healthcare works better when you're working as a team. And, you need you need your educators and your social workers that may be able to notice something that you as a parent may not notice, but then you also in turn feeling comfortable enough to listen to what they're saying to you and not feeling like you're being attacked or feeling like you're hurting, the others' feelings. And, then having those social workers in turn work with, general practitioners to see, are you seeing any of these signs either? And then working with a specialist. So kind of just, I think our healthcare system needs an interesting re-imaging of how we provide care, instead of like less of these little silos and more of pushing things together. Because I think that would also kind of help us kind of with those 10 divisions that you were talking about earlier to address more of them at once. If, we're able to have more of a team approach to it. But these are just me. What do I know? But
you know a lot more than most people.
Look, I try. And, it was interesting because I was talking about this last night with my sister, and she was kind of like, Simone, why do you know so much about FASD? And I was like, well, why not? Like, it's something that we see so much more. And we were just talking, and I was like, I really want to get a lot of my friends that are teachers to watch this, because, they're teachers for young elementary school kids. And as they're watching, these kids learn, and they know so much about how you learn, you're able to, find these signs and, be able to make an intervention, hopefully before that 6-year point that we could aim for, but even after. And in a space where, they have this bonded trust with their students, and, a bonded trust with parents as well, to be able to kind of see what could be the best way to intervene. So,
yeah, definitely the education piece needs to be almost with every facet of society, because like you said, it kind of touches on all of that. So
I agree. I'm reading one of this from FASD Warrior about full educational classes. I agree. I completely agree. I think, there's just a lot to learn. And sometimes I hate that we burden teachers with so much, but they just play such pivotal roles in our society of, helping us learn and grow. But
well, and in many ways, my mom's a teacher, and when she found out about this, she was like, why has no one told me about this? Like, I see this everywhere. And so in some ways it's a disservice not to tell them, because then they are working so hard for a kid that needs a different approach. So I am hoping that we can reach that market also. But yes, we got to tell everybody.
Yeah, I know. That's why I was on my Instagram today, and I was like, here's why you should care about this, and this is what it can help with. And, I think it's very interesting. One of the cool aspects of the clinic that I used to work in is they do this like longitudinal adult study where they've been following people who had FASD as kids and are now adults, and kind of seeing where they are along in their life. And it's just very interesting just to see the spectrum of how people are living and what they're living with and what they're struggling with, and to kind of watch it across this life course. I'm just like, why do more people not know about this? Like, we should all be talking about this. I'm like, we all see these signs in the bathroom with the Surgeon General of you shouldn't drink while you're pregnant, but like, what's the next step?
Well, that's a good point, because we talk about you shouldn't, but I never knew what the cause was. Like, I never tried to be pregnant, so I just knew like, okay, I guess you shouldn't, but I didn't realize it was like worse than drugs, and I didn't understand that what happens then. So I think that's part of our messaging that we have to work on, is that yes, you should not drink during pregnancy, because these are some of the factors that are involved. I think before we thought the factors, like I've heard a lot of like physical changes, but that's I mean, that is really not what the majority of kids are dealing with. So okay, well, we should stay in touch and keep talking about this.
Definitely. If I could there's one message I always hear, and that's what I always use when I talk about FASD. It's like 10 fingers and 10 toes does not equal a clean bill of health, or that everything's going to be okay.
Yes.
And so if you want to start taking that into practice, you're welcome to use it. I think it's really helpful. I really enjoyed talking to you today. Yeah. So hopefully we can do some more fun stuff in the future as well.
Yes, I'm looking forward to it. We got to educate all the audiences. Thank you for joining me, and I will get this video to you after I can do all my special download thingies.
Okay, great. Thank you so much. Have a good rest of your day.
Bye.
Bye.